This is Dr. Han with the Juice Compound. I get a lot of emails and questions over the week asking about what is the best thing to do for, let's say, plantar fasciitis. What's the best thing to do for my knee pain? And the answer is there is no universal cure. For instance, like plantar fasciitis, everyone says stretch your calves, roll the bottom of your foot. About how often does that really work? So I think the way to go is getting an appropriate movement screen to look at your movement quality and find out why these things are happening. I want to bring you a little example on myself and how my brain works when I look at single leg balance, which is part of the movement screen. So if I stand on my left, we're going to look at the foot and where my body goes. Okay? My foot goes in and out just a little bit, but not too bad, and my body stays pretty much right over my base of support. If we look at my right side, just look at my foot. The foot looks stable, but my body is actually to this side of my base of support. So just based on that, we can say I have some type of single leg instability issue. But that's easier to correct it. You need to know why. And I think we're in an age where we love to foam roll, we love to do all these things, but we don't have that type of time to foam roll my IT band, my quad, my glutes. You know, we want to get the most important thing and then start to work out. So for instance, when I look at a situation like myself, I stand, my weight of support is outside over here. I know something on the inside is overworking. And since I'm leaning this way, something on this side isn't working. So for me, for example, which may not be the case for you, I know my posterior tib, which is on the inside of your lower leg and does this with your foot. So let's do a before and after. Look at my single leg balance. Okay? That wasn't fake. I'm gonna do it again. So I like to rock out here. It's not much, but it does happen. I'm gonna do a self-release to my posterior tib. Just a quick one here. Okay. Now we're going to look at my balance again. Single leg balance. My ability to keep myself over my base of support is a lot better. Okay? And then you ask, does this make a difference? It has a lot of implications. We're looking at sports, we look at cutting sports. If my tendency is to rock out this way, every time I cut, I'm going to rock out that way too. So that means lateral ankle sprains, insufficiency when you're cutting off. So there's a lot of implications by looking at these minute details in movement. If you'd like more information, check out juicecompound.com.